Hello and welcome to Level 5 Health and Social Care, Unit 502, the Quality Unit. And this is week 3 where we're looking at service user feedback and we're also looking a little bit at stakeholders. Okay, so task 3 is 800 words because it's got 3 criteria. Okay. And in this week 3 set of slides, I'm going to look at 3.1 and 3.2. I will look at 3.3 in the week 4 slides. Okay, so we're just focusing on 3.1 and 3.2 today. Okay, so 3.1 asks you to evaluate the methods by which health and social care can gather feedback to improve quality. So you're just going to evaluate it, okay? So maybe some strengths and weaknesses, remember. And 3.2 just asks you to identify the stakeholders in the improvement of quality delivery in health and social care. So you don't really need to say that much. You just need to say who the stakeholders are. Okay, and I've got a little chart for you that you could maybe discuss. Okay. I'm not going to go into service user feedback and stakeholders in massive amounts of detail because we have done this quite a lot in your level 3 and level 4, particularly in level 4 during the health promotion unit where you did your when you put your little campaign together. So you had to learn quite a lot about gathering feedback and some of the methods that you used. So if you feel that it's not enough, you can go back and have a look at some of your previous slides. But I have also sent you to a little bit of resource stuff that you can to help refresh your mind. So this is just a refresher, really. Okay, it's not in depth. So patient feedback is defined as insight and opinion and shared experiences of your patients or your service users, and it just gets their perspective on the standard of the services and care they've received. So you could have general feedback in your service user support groups, or you could have some formal stuff with questionnaires every now and then. It could be any different form, really, or it could be just a one-to-one chat with someone, or someone actually addressing it through a complaints system. It's all feedback, really. And the primary area of feedback is to help healthcare providers like yourselves identify areas for improvement so they can enhance that quality of care. And that the experience for the service user is a better experience. That's what we're aiming for. That's why we're aiming to use the feedback. So even if the feedback's fairly negative, you've got to sort of try and turn it into a positive way that we're actually just there to improve things. So all feedback, no matter how negative, is a good thing. So why is it important? Well, we've already said it improves quality of care. It helps you identify areas where you have to particularly make changes. And that can be all sorts of parts of the patient experience. It could be the actual care that's being delivered, or it could be to do with, organisational issues, or it could be to do with communication. Often it is to do with communication. Are you informing people of things well? What's the mechanisms to inform people of things, and do they work that well? It reinforces that patient-centered or person-centered care that we want to deliver, that your organization or your care home or your clinic actually is there to consider the service users' needs, and that you sort of develop it around their needs, and it's not just about the way your organization wants to do it, but it's about you're doing it around their needs, and taking their feedback should be there to reinforce them that you're going to change things if it's relevant. It's also about ongoing improvement, which is part of your quality process, and you can make continuous improvements. It's not just a one-off situation, and you can tweak and refine your practices by picking up these issues and concerns. It can also help you pick up any gaps in the service where things just get missed or a certain aspect just gets completely forgotten. And you can actually include that and make changes. It's an element for accountability and transparency. It demonstrates to others that there's a level of trust between you and your service user, and that you're trying to maintain high standards. Other reasons why it's important is it helps to reduce medical errors, which can be a grave concern. So the quicker that feedback is, the better. So it's not something, if the service user found that something had gone wrong, they need to be in an environment where they can speak up and tell you about it quite quickly rather than waiting for the annual survey. So you have to think about having process in places for if people need to sort of want to highlight something that could be a real concern. Improves patient satisfaction if they know that they're going to be consulted and they know that you're going to act on what they're saying. That improves their satisfaction. They're more likely to comply with their treatment plan, and they often they experience a better outcome. Really important. Regulatory compliance. CQC expects you to do things like this anyway. So those of you who are registered by a regulator, the patient feedback, service user feedback, is generally part of their quality improvement requirements. And it certainly, if it isn't, it certainly looks very positive to prospective new funders and prospective new customers as well. So if you're a private care home, showing any possible friends and family of new residents that you actually do this is quite reassuring, and it might make them choose you over another organisation. Data kept on people's feedback is great for research and development as well. It can feed into sort of bigger research questions, which can be really helpful. And of course, it's an element of patient empowerment or service user empowerment, gives them a greater voice. And that in turn, the more voice they've got, even if sometimes things do go wrong in your care home or at your clinic, they can have a more positive experience of it if they know they're being listened to than if something went wrong and no one listened to them anyway. So moving into that, I've sort of jiggled it about a bit. We're going to talk about methods a bit afterwards because I think it's important to sort of first know what a stakeholder is, because we've talked here about feedback, but actually it's not just your service user that is a stakeholder in your organization. And you want feedback from more than just your service user. Your service user is really important to have very regular feedback from and very regular interaction, obviously, because it's part of the relationship of provider and service user. But there are other people who are stakeholders in your organization, and as such, they need to be consulted sometimes. So a stakeholder, what is a stakeholder? I've given you a little definition here. It's a person or a group with a vested interest in a particular clinical decision and the evidence that supports that decision. And it can include parents, caregivers, patient advocacy organisations, clinicians, their professional associations, institutional healthcare providers such as the hospital systems and medical clinics. So if you imagine you're in a care home, all these people can be stakeholders in your service as well, even if they don't see you very often, really. They may have an interest in something that you and the service user decides to do. So, who are your stakeholders? I've split it into a diagram that gives you two different types of stakeholders. There are always two different types of stakeholders, the internal and the external. Those inside your organization or inside what you do, and the people who are external but have a little bit of an influence. So let's think about the inside ones first. They are the employees. They are you, the staff team. Okay. You are a stakeholder in your service. It matters to you whether this service improves or doesn't. It matters to you whether this service fails or doesn't, because you'll be out of a job, basically. It's that simple, really. Um, so employees, clinical leads. So maybe you know, if you're in a care home, the nurse leads or the supervisors, team leaders, and the managers. Okay. And included in that, because the owner, if it's a private care home, it will be the owners as well. They're all part of the internal sectors. They are all part of the organisation, and these are the day-to-day stakeholders. Okay, in your organisation, and it matters very much to them, you and the rest of your team, how decisions are made and what other stakeholders' views of you are. Because again, you are providing a service. If the wider stakeholder group has a poor view of your service, then they will disencourage people to use your service, which is a real problem. Okay. So moving around that, we have people like looking at the external stakeholders, we have people like support groups. Now, they could be families and friends support groups. They could be local support groups of people with dementia, say, if you're a dementia care home, but they will have a stake, you know, they will have an interest in what you do as a care home, say. Also, the local community. You are placed, you don't live on your own, you're in a street, in a road, in a town, and you are part of that community. If there are things that happen in your care home that are, you know, not approved by the local community, that can cause frictions and problems. Okay. So you have to, don't ignore the fact that the local community, your neighbours, people around you, the shopkeepers that serve you, are still stakeholders in your service. The next and probably one of the most important stakeholders are those, I've got consumers. They are the people who use your service. They are your service users. Your patients, your clients, those who attend your clinic, live in your care home. And they're advocates. They can be formal advocates such as family, informal advocates such as family and friends of those consumers, or they could be people in formal advocacy schemes. So if you've got people who work in your who live in your care home who cannot communicate, they may have specialist advocates to help with their care plans, help speak on their behalf to make sure that their needs are considered. People who don't have capacity will have a formal advocate, especially when it comes to treatment decisions. People detained under the Mental Health Act will have formal advocates. Again, if you're making a decision that they might not want to agree with, a formal advocacy has to be brought in. Non-government organisations like NGOs, they can be pressure groups, support groups. They can be things like, you know, in this country, we have big charities such as Age Concern, do particularly active in speaking up for the elderly. We have Scope and MenCap for people with physical and mental disabilities. They are huge charities, work across the country, and they have information and support, but they're also pressure groups on the government to make changes. So they are a stakeholder in the service. If they hear about a service for elderly people with dementia that's not meeting standards, they will, they will want to know about it, and they will want to act as advocates, and they will, put pressure on local councillors, MPs, things like that. Government services, there are always some government services are involved. If you're funded by the local council, then they are stakeholders in your business. If you have any funding from the NHS or local council, and most care homes and clinics do, then that you are beholden to government services. Also, if you're an NHS service, you're part of the NHS, part of the health service, and legislation is set above by those government services, and the UK government sets legislation that you have to meet. It can be about health and safety, it can be about data protection, it can be about safeguarding. Either way, they're a stakeholder. They want to know that your home or clinic or hospital is meeting, is working within their legislation. Suppliers are stakeholders in your business. Do you pay them on time? Are you ready to take their deliveries? Do you mess them about? Do you give them short notice? I want to I want some food and I want it tomorrow. So they are stakeholders in your business, because obviously if they have a contract with you to supply all your meat, supply all your vegetables, supply all your laundry items, all your sheets and that, then it's quite important that they know what's going on with you, because if you close as a care home, they lose an awful lot of business. So they are stakeholders. We often forget them, but they are. Staff unions, if you do have a union, or if you belong to an organisation, like with in the UK, or say if there are nurses working at your care home or clinic, they are a member of the Nursing and Midwifery Council. They have codes of conduct they have to meet. If you as a homeowner is trying to make a nurse do something that breaches her code of conduct, that is a problem, and their organisations will soon get involved. And finally, the regulators, as I said, in the UK, you need to be registered with CQC to operate, whether you're a clinic, a hospital, a dental practice, a GP, pretty much anything really. So if you're not meeting the regulation requirements, it's important for them to know. So they are very interested in what happens in your organisation, and they will carry out their normal duties where they come and do inspections. So it really matters to them. Sort of when you make changes, sometimes if you make a large change in the organisation, you have to let them know as well. So they are very much stakeholder in how you run your business, and whether you run it well, the quality of your provisions. Okay, so that is all the stakeholders pretty much that would cover most health and social care. So all you need for that criteria is just to identify them. There's lots of charts like this you could find. You could add a chart if you wanted to, but I just want a little line about each one of them in the way that I've just said it to you. You can give me some examples as well. Just work within your word count. Okay, so let's think about different ways of collecting feedback then. So here I've identified patient feedback, but you could also try to think of some of those stakeholders and think how you might collect feedback from them as well if you wanted to. CQC will give you feedback whether you want them to or not, but others you might have to ask. Okay, so method of collecting patient feedback. I've done got a little cross here. This is from the Health Foundation. On one side, it's less descriptive. On the other side, it's more descriptive. So think back again to your level 4 when you did your health promotion and how you sort of gathered information, really. So you can use in-depth interviews. You can use focus groups and panels where you do a lot of qualitative research. Okay. You can get patient stories, anecdotes, and also look at complaints and compliments as well. Complaints are generally tend to be more detailed than compliments, but they do tend to give you quite a lot of information about a certain issue. We've got here ward rounds and observations for those people hospital based. And obviously that's a day-to-day thing, really. If you work on a hospital ward, when you go around to see someone, the doctors will sort of discuss the person as a case, and any observations you pick up, and hopefully they will ask the service user who's lying in the bed how they feel as well. So you'll be picking up information from their feedback. Or just when you sit down, work with them, on a day-to-day basis, helping someone get ready, hopefully your interactions will pick up some more anecdotal feedback, rather than maybe sort of formal surveys and that, which you should do as well. In care homes, they often have service users meetings, maybe once a month or that, where people can raise issues and discuss it. And if you minute the meetings, you get quite a lot of feedback that way as well. On the left-hand side, these are sort of less general things. Online ratings such as TripAdvisor. I don't know if there isn't a TripAdvisor for her hospitals and clinics and that, but there are, people, if some of them have Facebook pages and that, people might come back to them and comment on it. If they have a website, people might write into it. Any public meetings, which usually if it's about hospital or clinic, you might have a very large public meeting about sort of a big issue, and people will come there and sort of raise their concerns. In the smaller quadrant, I've got surveys, comment cards. Surveys, because they're not as in-depth as interviews, because they tend to have yes/no answers, or agree, don't agree answers, so less descriptive. Comment cards, you might often find those in the outpatients department, where they might have a suggestion box with some cards. You can just sort of fill something out quickly and shove it in, and that's the same as kiosk questions as well. Some of you might be used to that. You might just have a smiley face and an unsmiley face or an orange face. How did you feel about your weight today? How did you feel about your service today? How did you feel about your appointment today? And they might just press a button, or they might just tick a box, that sort of thing. Happy, like neither happy or unhappy, or very unhappy, that sort of thing. SMS questions. I've been getting that from the NHS lately on my phone, because we have an NHS app now, and the app sends out questions on behalf of your GP. Some of them not at all relevant to me, and some of them quite relevant to me. So, but what they do is they tend to sort of send out blanket ones to everyone on the patient list. So it could be about delays in repeat prescriptions or things like that. But they're usually questions that you just have a yes/no answer. Will you be needing this service in the next couple of weeks? Yes or no? Something like that. Or just letting you know, do you want a COVID booster? If so, will you book this? Yes, no, that sort of thing. So these are the different types. And as I said, some of them are yes/no answers, and some of them are in-depth interviews and focus group. We know about focus groups. We've talked about them in our level 4 as well. Now I'll just sort of run through them a bit. Surveys and questionnaires allow you to collect quite structured feedback. but the questions are yours. They can't really deviate from them, although you might give them some boxes to sort of add a bit. They can be administered digitally. You can send them out via phone. You can send them out via Facebook page, social media, and coming from that, you can create some quantifiable data and trends. Focus groups. They, as I said, they give you more in-depth insight into people's experiences because they're qualitative rather than quantitative. So they can go off track a little bit more, but they can tell you more stuff than maybe the question you were originally asking. Comment cards. Sometimes people can be quite candid with comment cards because they can be anonymous. They quite like that sometimes, and they just say what they think. So that's like suggestion boxes and comment cards or pressing buttons. Again, the chance of feedback in anonymous is very popular for people. So it's something you could do in clinics, really. Online reviews and social media is something we're all using nowadays, all of us to some extent. I certainly do. And if the healthcare provider does have a social media platform, then I can guarantee somebody will come back with some sort of comment. But so the most important thing is to make sure that you've got somebody monitoring these and, making notes of them. They can really be helpful. Again, you can post anonymously as well on social media. I know most of us hate that, but the thing is, some people choose to do it. It's a bit difficult when it's a vexatious post, when it's anonymous, but sometimes it can be valuable information. But that's one of the criticisms. If it's vexatious, it's often anonymous. Direct communication. Direct communication is when you're just sitting down with the service user, which you can do. Obviously, if you're working in care homes, you're with them every day. So it's just hello, Elsie, how are you? Really, how are you feeling today? Did you enjoy your dinner? It gives them a chance to say, actually, no, I hate liver. Is there anything else I can get you? Is there anything else I can do for you? That sort of interaction. When service users' families come in, a little bit of interaction with them, getting their feedback as well. We've moved to Elsie's room around. Are you happy with that? What do you think? Do you think that's quite effective? And that allows people they can actually say, well, actually, yeah, that's lovely, but I did want to talk to you about something else. And very often you can move from there. With clinics and GPs, after an appointment, you can often sort of say, how did you think that went? Is there anything else that's bothering you? Very often the difficulty with clinics is you have time allocation. And sometimes when you get to the end of it, you've hardly got any time to ask the service user if they were happy, which is a bit of a shame. So sometimes it's quite good to just give them a comment card and ask them to maybe take a minute outside to write their comments and drop it in somewhere. They might find that easier. But there are lots of ways that you can gather this feedback. Okay, so as I said, I've just refreshed your mind a little bit because we have talked about a lot of this at length in level 3 and level 4. I have put some resources on it to refresh you even further. So you can read up on the difference between surveys and questionnaires. Although I know some of you have used them, it's just a sort of refresher. I've also given you some information on qualitative versus quantitative research because you might want to address that as part of your response. I've also given you a couple of research articles on feedback tools and how good they are, what's good, what's bad. So you can use that to evaluate your methods. You need to evaluate them. So you can talk about, areas where they work better and areas where they don't really. There should be enough in the resources that I've given you, really, to answer that question perfectly clearly. Okay. that's it for week 3. So again, if you want to ask any questions about it, or if you want to check something out with me, use the WhatsApp group, and I'll respond to you, no problem. Okay. Please read the resources I've given you, especially if you don't remember some of the conversations we've had in the past about this. Okay. Otherwise, though, I will see you in week 4. Goodbye.